The daily updated count of cases and deaths during the COVID-19 pandemic have served as important indicators throughout the crisis, informing policy decisions, research, public awareness around the world. And Nigeria is no different. The ongoing data collection or surveillance is a key component of public health practice. But how much of that practice are healthcare systems using, and how can this help as we battle the COVID-19 disease? Dr. Rike Oginyemi is a public health physician. She joins us here in Lagos. Welcome to the program.
Thank you, Minister. It's always a pleasure to be here.
Before we come to talking about data and its impact on the public health, we're seeing a lot more high-profile Nigerians contracting COVID-19. What is happening? These are people who are sounding the warning, preventive measures, and they're contracting COVID-19.
Well, I think it's just a wake-up call for everyone to realize that we're all humans at the end of the day. The COVID-19 virus is not a respecter of person, so nobody's immune, by and large. Now, the fact that we're having records of high-profile people still doesn't rule out the fact that the average Nigerian, the common man, isn't having it. But just because they're high-profile, they get the publicity. But it's a cross-border. The rich, the not-too-rich, everybody's contracting COVID-19. So it's just a wake-up call that everyone should be a little more careful with the instructions we're given on how to actually protect ourselves.
Let's go back to data collection. Looking at our healthcare systems, especially in an emergency situation brought out by a pandemic, how important is it?
Well, let me start this way. You know, when networks are making their adverts, they say data is life. Now, data in the sense of course, airtime and all that, but also in public health. Data is life to us. Now, your data would help you to make decisions. Your data would help you to decide if a policy is worth it or not. Now, recently I was looking at the statistics that we've churned out concerning COVID-19. Now, it all started 27th of February with one person who came into the country. Now, it took us about 3 weeks to shoot up to, I think, about 12 or thereabouts. 3 weeks, not too much. And then the lockdown came. Now, from the period of the lockdown to the time the lockdown was eased, we had about 1,000 cases. Now, when the lockdown was eased to, I think, sometime in May, we had almost 8,000 cases. Now, look at that margin. Look at the number of cases as it skyrocketed from about 1,000 to like 8,000 within 1 month of easing of the lockdown. So the data we're actually collating should help us to decide if what we're doing is right or wrong.
Do you trust that data with students' safe reopening? We've been assured safe reopening of students for the examinations period.
Okay, let's look at it from a different angle now. Back to data again. If you look at the statistics, you look at the age brackets, because that's also part of data. Look at the age bracket of people who have been infected the most. We're talking about 30 to 40, those with higher morbidities, 50 to 60. Okay, now, despite the fact that the age bracket is 30 to 40, now we've also recorded deaths in age bracket of 11 to 20. At least I'm sure of 3 death cases, if not more now, 11 to 20. Less than 10, there's also a record of, mortality. Now, if we're opening schools, are we sure that we're able to actually enforce the directives to prevent the spread, vis-a-vis the social distancing, use of face mask and all that? So if we're looking at reopening schools, a lot of caution. I would advise that, it's not very feasible to shut down the system for too long. It will paralyze so many things. But yet, we can't afford to lose the lives of people. So I'm looking at, if we're opening schools, will there be a time frame? For example, maybe those in the senior classes, maybe SS1 to SS3, will have their classes maximum of 2 hours. Let's say they run it 10 to 12, they go home. The next class comes in, they run it maybe 1 to 2, thereabouts, so that we're able to stagger the number of pupils or students that are going to be in the community or environment, the school environment at a time.
Would your answer be different if you were to advise the Lagos State governor from a governor of Kebbi State?
Okay, advice in
terms of school reopening, in terms of the, curtailing the spread of COVID-19 this period?
Well, I would say that if all the things that need to be in place are in place, they could do a test run. Test run in the sense that maybe you have a certain class coming to school, and then we observe for like a month. We run the tests. If we don't have an upsurge in COVID cases in those children, okay, we could extend it to a next phase and allow a little more students into the class and then observe. But data, of course, the more you test, if you get less pupils getting infected, then I think we're on a safe path.
All right. We'd like to thank you, Dr. Rike Ogiemi, public health physician. Thank you for joining us on the program.
Always a pleasure, Millicent. Thank you.
We have more on the COVID-19 updates when we return. Stay with us.